For more on the management of COVID-19 patients, I am now joined from Atlanta, Georgia, USA by a registered nurse with specialization in nephrology, Yinka Oluwa. Thank you for joining us on TVC News at 10. Well, I must say that as someone who is at the thick of providing help to a patient with COVID-19, you look unruffled. Help us understand, what is a normal day like for you?
First of all, I greet my people in Nigeria. How are you guys doing? COVID-19 has become a menace in the community and around the world. But I guess I want to say I went to work today, put in my 12 hours as usual. But what you're seeing right now is, thank God for makeup. It wasn't like this early this morning. But again, life before COVID-19 was the normal. The normal is you're able to take your lunch break, you're able to take your bathroom breaks, you're able to unwind, you're able to go down, up and down the stairs during work to, kind of rejuvenate. But now that COVID-19 is here, all of that is being thrown out into the drain. Only because, you've been pulled here and there to come help, your coworkers, to come see to patients that probably you've not even handled before. So yes, COVID-19 is really, really rough in the hospital. But, as healthcare providers, that's what we signed up for, and that's what we're doing.
Indeed, because we've heard of over the last few weeks how overwhelmed caregivers are, especially because of the number of times the code 11 has sounded. Let's talk about personal protective equipment. It's in short supply globally, and of course this exposes healthcare personnel and front responders to great risk. How are you and your colleagues able to protect yourselves in the line of duty?
Well, protection. Well, prior to COVID-19, we've always had what we call standard precautions, where, when someone is just coming in through the ER, which is the emergency room, we have to feel like, okay, we don't know what they have, so we need to, just assume to protect. So we will be donning our gloves, our, gowns, and our surgical mask. But now it's a situation where we have to do more than that. We have to put on shields, we have to put on respirators, we have to, put on a whole lot of stuff. And with the weather, summer coming in, I must tell you, it is really uncomfortable. It's like you feel really hot. You feel like some days you feel like you can't wait for COVID-19 to be gone. But as healthcare providers, we're doing what we can. We're protecting ourselves with what we have in the hospitals.
And as it is, some nurses themselves have tested positive for coronavirus. Not just nurses, doctors, other healthcare workers. And we've had stories about those who talked about the N95 mask. Talk to us about the issue of wearing masks and gloves.
Well, like I said earlier, but prior to COVID, you have a lot of precautions. First of all, you have your droplet precautions, you have your contact precautions, you have your airborne precautions. For instance, the contact precautions is something like, MRSA, like when someone has measles, or you have, they have like a CD, like I want to call it cholera, kind of stool. So what we put on is the gown, the gloves. Technically, we don't put on the mask, but since it's contact. When it comes to droplet, that's when you have to put on the mask. Let's say someone has like whooping cough, or you have like diphtheria, so you put on the surgical mask and then you put on the gown and the gloves. But now with COVID-19, it's like you have to do more, because even though you don't know if your patient is positive with COVID-19 or not, you still have to assume that they have COVID-19. So you have to gear up for that. So N95, again, prior to COVID, we use the N95 mask for patients that have airborne diseases like tuberculosis and measles and chickenpox. So, and our employers, you have to get fitted for the N95 mask. So, because the effectiveness of that mask is if it is well sealed all around. So, and then we put these patients in negative pressure rooms. So what that means is that when we go in the room, we put your N95 on, you put your gown on, Sometimes you put your shield on in case you want to deal with bodily fluids. And then when you're exiting that room, you have to take out the mask and put it in like an alcove. You can't bring it into circulation on the unit. So, and then you can't wait for a long time. So right now, I don't know. People are wearing this mask and they're not fitted. They've not fitted for it. The effectiveness is not known because there are a lot of do's and don'ts with the N95 mask in order for you to be able to get the effectiveness. So you cannot.
Okay, let's look at another critical aspect of this. It's the issue of funding. The U.S. is the largest contributor to the World Health Organization, and now President Trump is halting U.S.'s contribution. How do you react to that?
Well, we all know that with COVID-19, I don't want to be political here. So all I can tell you in terms of what's going on now is what we are doing on the forefront. Most of the time, you know, you have to kind of block your your attention to other things going on. As a nurse and as a healthcare provider, I am just more focused on my patients. So in terms of that, I would just leave that to the political gurus to handle that.
And as a specialist in nephrology, how have kidney patients fared, considering they have underlying health challenges and they are more susceptible to contracting COVID-19?
Oh, definitely, definitely. And that's the reason why most of the time, even though we healthcare workers are really anxious, we're scared, we're like wondering what next, what is going to happen. So, but then when we go and see our patients, we don't want to take that emotions to them. We want to cheer them up because already they don't even want to come in for dialysis. You know, the emotional and psychological trauma is already there prior to COVID. So the protection is much, much higher now. So what we're doing is prior to them coming into the clinic, when they're sitting in the reception area, everyone has to have their surgical mask on. We have to get them their temperatures taken. So if it is higher than 100.2, we're sending them back home or to the hospital. We're not going to bring them into the whole circulation. So I'm protecting myself and protecting them. So most times they don't want to do some stuff. They don't want to wear gloves. They don't want to put the mask on. But we're like, you know, we have to protect you. So I put mine on. You see mine is on. You have to put yours on. And that's how it goes. So it's really challenging.
Challenging indeed, but I must say all healthcare workers the world over are doing a really great job at this time in the front line of defeating COVID-19. Yinka Oluwa, registered nurse with specialization in nephrology, joined us from Georgia in the United States of America. Thank you for talking to us on TVC News at 10.